How to have a safe and healthy pregnancy after a miscarriage. Most miscarriages are the result of a chromosomal abnormality in the developing fetus, not the result of something that the mother or her partner have done. A miscarriage is a very traumatic experience for both the mother and her partner, but it shouldn't discourage the parents from trying again. A miscarriage is often reported as being a one-time experience, and in most cases any subsequent pregnancies will develop normally, without any serious issues. Taking adequate precautions. Understand when it is safe to try to conceive again. Your first questions after going through a miscarriage may involve around when it is safe to try to conceive again. The correct timing usually depends on two different factors, your physical health and your emotional well-being. Physically, it is possible to get pregnant again as soon as menstruation recommences and you start to ovulate. This generally occurs 4 to 6 weeks following a miscarriage. You can begin trying again after one menstrual cycle has passed. However, you can wait longer to try again if you want to. It may actually be better to conceive sooner than later after a miscarriage. Research suggests that women who get pregnant within 6 months of a miscarriage of their first pregnancy are more likely to carry to term versus those who wait 2 years or more. 2. Make sure you are emotionally ready to conceive again. Miscarriage can be devastating emotionally both for you and your partner. Thus, it is important you allow yourself to grieve and do not rush into a new pregnancy too soon. Even if you are physically ready for another pregnancy, it might take you longer to prepare emotionally. Thus, you should assess your emotional well-being before you try to get pregnant again to ensure you are ready both physically and emotionally. Talk with your partner and sort through your feelings together. Do not shut each other out but instead understand the emotional toll that the miscarriage had for each of you. If you are having difficulty dealing with the miscarriage, consider hiring a therapist. They can help you to work through any feelings of sadness, anger or guilt that you are feeling and enable you to accept the loss. Identify what can cause a miscarriage. Miscarriage can occur for a variety of reasons, even if you are perfectly healthy. Becoming aware of possible causes of miscarriage can help you find direction in your family planning. There are some factors that cause miscarriage that are out of your control. Genetic abnormalities within the fetus can cause the pregnancy to terminate prematurely, which is the most common cause of miscarriages. Uterine abnormalities may trigger a miscarriage if the uterus cannot support the pregnancy. Uterine polyps or scar tissue are examples. Your chance of suffering from a miscarriage increases as you advance in age or if you have a chronic illness. However, there are some factors that increase the risk of miscarriage that you can change, including stopping smoking, avoiding alcohol, maintaining a normal weight, and reducing stress. Consuming lots of caffeine may also increase your risk of miscarriage, but a moderate amount of caffeine will not. 4. Try to keep your caffeine intake below 200 mg per day, which is about the same as a 12-ounce cup of coffee. In addition, certain infections toxoplasmosis, rubella, cytomegalovirus, herpes simplex, and poliomyelitis may cause miscarriage and thus you should consult your doctor how to avoid these. Undergo diagnostic tests. If you have had multiple miscarriages, then you may need to have some tests run to check for problems. Before trying to get pregnant again, you can undergo diagnostic tests to help you navigate any underlying fertility issues. A blood test allows your doctors to determine hormone levels in your bloodstream and any components of your immune system that may affect your pregnancy. 6. Chromosomal tests from both you and your partner allow your doctor to discern if you are carriers for chromosomal abnormalities that might lead to a miscarriage. 7. An ultrasound allows your doctor to create an image of the internal organs in your pelvis, allowing them to identify if there are abnormalities with your uterus. 8. A hysteroscopy is another imaging test during which your doctor inserts a camera into your birth canal in order to see your uterine walls and fallopian tubes. 9. Consider genetic carrier testing. Genetic carrier testing provides important insights about the genetic material you pass on to a possible child. Meeting with a genetic counselor allows you to find out if you are a carrier for a genetic disease. Some genetic disorders contribute to increased risk of miscarriage if there is a chromosomal abnormality in the fetus. 10.